I'm Kathleen Whyte. I'm currently the program director at Ridgeview Ranch, which is an adult substance abuse treatment facility in Altadena. And I also have a private practice in Larchmont under supervision of Dr. Danzinger. We were looking for a clinical supervisor, and Dr. Danzinger's name came across my plate from a colleague, and we are a 12-step based program for addiction, and we've incorporated mindfulness in terms of having meditation groups in the morning. We're not really Buddhist focused, but when I started to learn more about Dr. Danzinger, that practice, and particularly bringing EMDR into our program, was the primary focus for us. So we didn't know what we were going to have because we've not experienced it before, but the process of bringing trauma-informed care into addiction has been significant in terms of how we've been able to assist clients in reducing symptoms of anxiety that often are precursors to relapse. So there's a big problem in the addiction world where clients would come into treatment, and then because it's financially or insurance driven, they're not able to stay in treatment for the periods of time that they really need to be in treatment to reduce all those symptoms and really to address addiction. So EMDR therapy has been a component that we can start to incorporate from the beginning when a client arrives to begin to address some of that and hopefully have a long-term effect on the client's ability to stay clean and abstinent. EMDR has a set mode to address the process, so there's a real structure to it. So it's almost as soon as a client comes into treatment, for me, I'll talk for me personally, but it's pretty much our clinical team now thinks in this way after having the EMDR training. We're looking at the client in terms of how has trauma affected their addiction, because this, again, is a key component that contributes to relapse, and many clients don't get to address that. So the minute they walk in the door, we're in our minds thinking, okay, where is this client sitting in terms of their resourcing? Where is this client? Have they ever addressed the trauma? What kind of therapies have they had in the past? And we're thinking in the EMDR protocol, where do they sit, and how quickly or how slowly do we move into being able to get to the reprocessing phase? With addiction treatment and substance abuse facilities, you're usually dealing with a client who's just relapsed. So they have a lot of detox symptoms. So first we're looking at stabilization, which is the beginning phases of EMDR, but everything we work with the client is EMDR based at this point. So it's changed the way we look at addiction completely. Just beginning to have awareness and bringing that to the client, and also beginning to resource them, which is, how do they ground? What methods do they internally already use to ground themselves? What are their resources? Helping them discover what their resources are, helping them to identify and think in this manner, oh, I have some resources already in place. So helping those to further develop within the client for them, and just really, I guess it's a lot of just awareness on both sides, and being in the moment to moment with the client, and just supporting them in that method. The training with Dr. Danzinger in our facility, to train with other clinicians that you're working with is, really beneficial, because we're speaking the same language. Two, there's, EMDR brought in components that I wasn't aware of, so it's, I was able to experience the relief being trained as an EMDR clinician that the clients were receiving. So it began to reduce some long-term issues that maybe weren't addressed in my therapeutic process, and did it in a very short period of time. So the ability for EMDR to have results within a smaller time frame is really beneficial, again, when you're talking about working on addiction treatment and you only have the client for a certain amount of time. And in terms of self-care, I now have other clinicians where in this field, the ability to burn out is so grand. I mean, the self-care in the healthcare industry is something that we just all are not doing enough of. So we have peers that are there for us, and we can reach out to them. And so it's just kind of broadened the resources that are available to me. Mindfulness has always been, again, something that was intuitive for me, and I hadn't put a name on it yet. I didn't have phrases around it. I didn't have the education around it. So having it more in the forefront, it just gave me an awareness that, oh, I've always worked this way. My body knew that this is what I wanted. You know, where things are felt in my body, the somatic portion of the EMDR process just, spoke to me right away. Like, where is that happening? And going through this just really helped me clarify a method to really be able to guide the client through and also give them the intuition that I was feeling so that they could rely on what was happening on the inside for themselves as well. So they knew that that was a place for them to go to for answers and for grounding. Prior to Dr. Danzinger coming on board, we had clinical supervisors, which were great in their own method, but this process actually feels like it brought us all together into one, common thread. So that when we talk about a client, we know exactly where they are. We could hand them off to another therapist if necessary. We could assist one clinician if they were struggling with, should I move into this phase or not? Is this client resourced enough? They're stepping down from residential to IOP. Do I want to start this phase here, or do we wait till they're here? So being able to discuss that with a team of people and having the guidance of Dr. Danzinger just really overall made us a stronger clinical team, and that's one of the things I boast about Ridgeview Ranch is that is our strength, and again, bringing this component into Ridgeview has just shifted the way we think about addiction and trauma across the board. I'm on a path, and the team I work with, we're on a path, and looking for, how is this continually evolving for us? We're part of something that was started, and we want to grow along with that process. So the more we can bring our entire staff into this protocol and awareness, the better off our treatment for the clients is. Because again, they're walking in the door, and if only the clinicians are aware of what the client needs, then you're kind of not providing all the service you could. So the sooner we give our support staff some of the same information so that they are thinking of a client also the moment they walk into the room, then they have more awareness of what that client needs and how to really serve them. That's the business we're in. It's really taking care of people and serving them and not re-traumatizing. In my private practice, and also, I guess, also at the treatment center, the client isn't aware, but my brain is just now structured to think EMDR. And as the client's speaking, part of me is like, oh, I can't wait until we can get to the reprocessing of that event with this person. But just, again, always having awareness that resourcing is so important before moving forward. So being able to describe EMDR therapy and the process to a client and letting them know that before we go into these events, and again, you know, the idea behind EMDR therapy is that you're not re-traumatizing, you're just doing highlights. And that is such a relief to clients to hear, and that I get to see the magic of the work. And I have one client who, she likes the bilateral stimulation. She doesn't like the tappers as much, but I can watch the hypnotic effect of EMDR working for her in the middle of that, and I can see the change in the body right in front of me. And again, it's just, you watch the symptoms just dissipate, and it's just, it's really great to be a part of that.